War is often viewed as the last place that good things can come from, although war has been one of the leading causes for the advancement in medical technology and treatments. Medical techniques, procedures, and medicine developed by the military have been used to save lives both on the battlefield and off. Going into the military myself, I know the importance of life-saving treatments and the use they have had in our history. The beginning of the development of medical treatments can be traced to Valley Forge, where George Washington exposed his troops to small doses of smallpox so they could grow their immunity. The Civil War, also the Civil War, where new techniques and female nurses saved countless lives in our deadliest conflict to date. In World War II, where combat medics came to soldiers' aid within seconds to perform life-saving operations. According to the Philadelphia Campaign, one of the most trying times in U.S. history was at Valley Forge. During the winter of 1777 to 1778, there were 11,000 troops stationed at Valley Forge. The army was mainly undisciplined, low on manpower, and malnourished. The troops there had to fight hunger, severe cold, and one of the worst outbreaks of smallpox in U.S. history. Within weeks of arriving at Valley Forge, 2,000 troops were sick. It is said that 4 in 10 victims die. Surgeons learned from African slaves how to harvest a small amount of pus from a smallpox victim and smear it into the open cuts of healthy victims. The hope is that the infection spreads at a slow enough rate that the white bodies attack the virus before it can become fatal. Washington's gamble pays off, and the death rates fall from the thousands to the dozens, as only 1 in 50 cases result in death. Leaving Valley Forge, the U.S. Army was better disciplined, better trained, and ready to take on the British in open combat. The breakthroughs that the surgeons made during Valley Forge saved hundreds of lives and pioneered vaccines in our modern-day society. The American Civil War was another critical time in history that medical practice was improved. The deadliest conflict in the U.S. history was with itself, the American Civil War. Approximately 620,000 soldiers died from combat, accident, starvation, and disease during the Civil War, based on CivilWarFact.org. With the 620 that did die, 2/3 of those that died from disease, as germ theory was not widespread at the time of the Civil War. However, amputation, anesthesia, inhaler, closing wounds, chest wounds, facial reconstruction, and the ambulance to ER system were all created. Although hundreds of thousands died of disease and infections, hundreds more would have died if not for the work of dedicated nurses and surgeons. Many women are known for their work as nurses during the Civil War, including Dorothy Dix, who was the superintendent of female nurses, Miss Truth, along with Harriet Tubman, both of which fought for civil rights and aided in the Underground Railroad along with nursing wounded troops of their race. Claire Bartman established the American Red Cross, seeing the need of health care during times of peace. They also pioneered simple practices that saved countless lives. These included to make sure that bandages were cleaned and changed, patients were comfortable, and wounds were cleaned every so often to ensure that no infection took place or spread. Although surgeons and nurses saved thousands of lives, in many cases the wounded died from waiting too long to get help. The combat medic was one of the biggest lifesavers during World War II. A wounded soldier had an 85% chance of survival if treated within the first hour, according to Army combat medics. In past wars, wounded soldiers were forced to wait after the battle was over for ambulance and stretcher bearers to come to their aid. They sometimes would bleed out or succumb to their injuries during that time. This dramatically increased the number of casualties compared to what they could have been. The use of combat medics saved countless lives due to fast-acting new drugs and techniques, along with the placement of combat medics. Penicillin and other drugs were discovered, as well as advanced surgical techniques. Combat medics would respond to their fellow soldiers, sometimes in direct fire, to provide first aid and life-saving operations. With the use of combat medics and these new techniques, mortality rate dropped dramatically as what it could have been. War should always be the last resort, if even considered. But the life-saving medicine and procedures developed from them can save hundreds of thousands of lives. The developments made during a war have such as George Washington's pioneering the vaccine, simple but important duties as nurses have, as needing clean bandages and patient comfort as practiced by the nurses in Civil War, and the combat medic who saved the lives on the go and under fire have saved countless lives. The next time you think of war, think of all the lives that have been saved by the astounding developments that it produced.